Her Excellency Robyn Mudie to speak a few words.
Good morning. Like other speakers before me, I would just like to give a general acknowledgement to the range of distinguished guests we have here this morning, distinguished professional colleagues, participants from overseas, and other people who are taking part in this event today. I'm delighted to be here on behalf of the Australian Government to participate in this inauguration ceremony for BioInquirer 2014. The conference has been organised by the International Institute of Health Sciences in order to share the latest knowledge and innovations in modern trauma and emergency care. Although I haven't acknowledged others individually, I would like to acknowledge the presence of Dr. Amal Harsha de Silva, Additional Secretary, Ministry of Health, who, as well as being a champion of the improvement of health services across the country, is also one of the driving forces behind the IIHS. I would also like to give great credit to the Chairman and Board of Management of the Institute. I'm sure, thanks to their hard work and dedication, this event will be both enlightening and rewarding in a professional way for all of you here. I very much welcome the presence of academics and healthcare professionals from Australia, Malaysia, the UK and the United States, who have travelled here to Colombo to share their expertise and knowledge. The Australian High Commission, through Austrade, is very proud to be supporting this event for the third time. As anyone who has ever had to call on emergency services would know, when you are faced with a medical crisis, you want to be assured that your loved one, family member, colleague is going to receive the best possible care, whatever the problem. And that care is only as good as the professionals who deliver it, whether they're in the nursing corps, among specialist practitioners, or part of paramedical teams who offer such vital first response support. As Dr. Katsiri has said, the objective of this conference is to introduce modern management concepts and practices in managing trauma and emergencies, covering all four major disciplines in health: medical, surgical, obstetric and paediatric. This is a significant endeavour which has the scope to greatly improve the effectiveness of emergency services here in Sri Lanka. It will improve Sri Lanka's overall quality of health service delivery, assist it to continue to refine and expand emergency health care to meet ever-increasing demand, and offer real benefits to the people who need to call on emergency services in the future. I'm delighted to see the participation of so many medical and healthcare professionals at this conference, and the contribution of a number of academics participating from foreign countries, including Australia. This all points to an event which will be of real value to participants, and which I hope will deliver real benefits to future patients and their families in Sri Lanka. Australia is very proud of the cooperation it has with the IIHS and Australian education institutions, a number of which are represented here today. A number of institute students are earning Australian qualifications in nursing, which in turn provide the opportunity to work in Australia, here in Sri Lanka or other parts of the world. Australia is a recognised world leader in providing international education, with 500,000 international students studying in Australia each year. This figure includes a sizable number of Sri Lankan students, who, we like to think, come back to home to Sri Lanka carrying a little bit of Australia with them. We're pleased that the number of Sri Lankans choosing to pursue further education in Australia is on the rise, with Sri Lanka among the top 10 countries for international students who choose to undertake higher degrees in research in Australia. In the medical sphere, Australian scientists and researchers have been responsible for major breakthroughs and technological advances, such as the bionic ear and the cervical cancer vaccine, both which have the power to save and transform lives, and both which came about through years of painstaking research. So study in this area in Australia has the potential to see Sri Lankan medical practitioners and researchers contributing to similar breakthroughs in the future. Sri Lanka and Australia have a strong relationship that goes back over many decades. It's underpinned by many different points of engagement, such as migration, sport, shared membership of the Commonwealth, and development assistance. The education and academic ties between our two countries are particularly strong, and they go all the way back to the 1950s when the Colombo Plan was first started. We're very proud of our education system, and we're proud to be sharing it with Sri Lankan students. Through engaging in international education, Australia helps build knowledge and understanding which in turn supports the growth and prosperity of Australia and its region. We are also very proud to be able to support events such as today's BioInquirer International Health Conference, which build on the strong ties we share through education and extend our sharing of knowledge and expertise in a very practical way. I'd like to acknowledge the support provided by the Western Australian Government and Global Health Alliance Western Australia to the Institute to organise this conference. I hope that the event will be of real benefit to all participants and that its end result will be to see further improvements in emergency services delivery in Sri Lanka, with a consequent benefit to patients and their families at times of medical crisis. Dr. Nilan De Silva rather modestly said that after 12 years, the IIHS had made an impact, but he wasn't sure how big that impact was. I think I can safely say that for any member of Sri Lankan society or their family who has benefited from improvements to healthcare delivery at the hands of professionals who have been trained by the Institute, the impact is immeasurable. I'd like to congratulate the Institute on its sustained and meaningful impact on the Sri Lankan healthcare sector and wish it continuing success in the future. Thank you very much.